Donna, for the Liberals, things have not been going according to plan in the early days of the campaign. The deteriorating situation in Afghanistan has followed the Liberal leader from coast to coast. And here today in Hamilton, he was asked whether he can balance his attention on a foreign policy crisis as well as a political campaign where winning is all or nothing.
Canadians across the country are thinking about, yes, Afghanistan, but they're also thinking about how they're going to get through this pandemic, how their kids are going to get back to school when they're not vaccinated and stay safe.
Afghanistan isn't the only timing issue for the Liberal leader. The optics of calling an election in the middle of a fourth wave of COVID-19 have continued to follow him. And while the Liberals want to frame this as an election about big ideas, so far the party has been short on them. And the Liberal leader has not committed to releasing the party's platform before the debate. And the sunny ways of years past has this time been punctuated with edited videos of his main rival, wedge issues like mandatory vaccines, and even attacks on provincial political rivals, including a threat to claw back healthcare dollars from Saskatchewan over private MRI clinics. So far, the strategy isn't playing well. The Liberals have squandered the 5-point lead they held over the Conservatives heading into the election. A new poll from Ipsos suggests the Conservatives and Liberals are now statistically tied. The poll also found Justin Trudeau's popularity is down, with his approval rating dipping below 50% for the first time during the COVID-19 pandemic. Ipsos found 33% of voters would support the Liberals if the election were held tomorrow. That's down 3 points from last week, while the Conservatives went up a point to 32% of the vote. Discussions in political circles have shifted from a majority to the possibility of another minority. And while there are just a few weeks left in the campaign and Justin Trudeau has shown himself to be a strong campaigner and anything could change, he may need more than his record and his current promises to win over voters. Donna?
Mercedes, thanks. NDP leader Jagmeet Singh used a campaign stop at a long-term care facility in Ontario to make the case for an end to profit-making long-term care homes. More than 14,000 residents in care homes died in the first and second waves of the pandemic, and all the major parties have substantial policy proposals to better protect those living in long-term care. Our chief political correspondent, David Akin, takes a closer look.
The pandemic data has been crystal clear. The vast majority of COVID-19 deaths in Canada were in long-term care homes. And those in long-term care homes operated for profit were sick and died at a much higher rate than those in non-profit homes.
The research is quite clear. Overwhelmingly, not-for-profit has provided a better quality of care than for-profit homes.
That's why the NDP is pushing a ban on the practice of running long-term care homes for profit.
We've said really clearly, it is wrong that for-profit exists in this system. That there should be no profit that puts people as a less priority than profits and money.
Maureen McDermott's 91-year-old mother died of COVID in a for-profit long-term care facility.
The stories are horrendous. Profits do not belong inside of long-term care, and in fact, profits kill seniors.
Singh and McDermott push for the ban while standing outside of the corporate headquarters of Revera. That's a private, for-profit LTC operator controlled, coincidentally, by the Federal Public Sector Pension Investment Board, a Crown corporation.
Out of all private for-profit long-term care operators, they actually have the highest number of deaths in Canada. Over 860 deaths across 56 facilities.
Neither the Liberals nor the Conservatives agree with a ban on for-profit LTC facilities, but each party has made substantial commitments on long-term care. The Conservatives would have set aside $3 billion for upgrades and repairs to long-term care homes and have promised to, quote, encourage non-profit operators. The Liberals are promising to spend $9 billion on long-term care, establish a minimum wage of $25 an hour for personal support workers, and hire 50,000 more of them. And so, for the first time in a federal election, taking care of people in long-term care homes is a major campaign issue. And advocates are hoping that after all this election talk, there's some action when the vote is done. Donna?
Well, everybody hoping for that. David Akin in Mississauga, thanks.